And they've got reddening of the eye, conjunctivitis, sometimes even ear pain, and popping sensations in the ear, which are all connected to the sternocleidomastoid muscle. So, hello, my name is Simeon Neil Asher, and for the trigger point of the week this week, I thought we would explore the symptom of the week. So what we're going to do is come into the software. We're going to look into symptoms, and what we're going to look at today is tearing, reddening of the eye. So I thought something that I find fascinating about trigger points is this whole notion of having a sympathetic or even a parasympathetic response. So the main muscle to look out for reddening, tearing of the eye is the sternocleidomastoid muscle. So sternocleidomastoid, two heads, the sternal head and the clavicular head. And the sternal head is slightly more superficial, more anterior, and it tends to have different symptoms to the clavicular head. Clavicular head, broader, and in many ways, again, slightly different function. So we can talk about those now, but in general, the maps are like this. So we have a map: pain above the eye, pain in the vertex. And interestingly, with the sternocleidomastoid and the symptoms that we're going to speak about now, I've seen this several times with whiplash patients. So they've come in, they've got some pain on extension, and they've got reddening of the eye, conjunctivitis, sometimes even ear pain, and popping sensations in the ear, which are all connected to the sternocleidomastoid muscle. So, as we said, a sternal head and a clavicular head. In terms of the pain patterns, the sternal head sometimes appears like a sinus, so sinusitis. You can actually have people that can come in and they say they've been told they've got a sinusitis, they've tried antibiotics, and it hasn't made a difference. It can cause things like ipsilateral sweating of the forehead. It can cause ptosis. Trigger points can cause ptosis on the same side, so change in pupil response. Conjunctivitis, rhinositis, so running noses. So running nose, blurring of vision sometimes. So these are kind of sympathetic responses that we see in association with trigger points in the sternocleidomastoid muscle. Interesting, right? In contrast, the clavicular head is a slightly different bunch of symptoms. Clavicular head tends to be people that have some more pain as they hyperextend the neck. So as they put their head on a pillow, or even sometimes I've had it with patients who are washing their hair in a hairdresser pre-COVID, and when they put their head back, they would get some symptoms there. Again, sweating, cooling sometimes on half the face ipsilaterally. Interestingly, by the way, that patients tend to want to sleep on the affected side, on the side of the lesion in terms of the sternocleidomastoid. But what's also interesting with the clavicular head is this notion of disequilibrium. So this kind of sense of imbalance between the sides. So in terms of the sort of sympathetic symptoms, sympathetic nervous system symptoms, really the sternocleidomastoid is absolutely florid in its presentation. Again, a muscle that's somewhat easily affected by hyperextension lesions, whiplash, sometimes injuries, occupational, postural changes, a sort of upper cross pattern can cause a shortening through the sternocleidomastoid as well. So that's in terms of the trigger point of the week. We're going to cover that one, which is tearing, reddening of the eye, drooping of the eyelid, ptosis on that side, and a whole plethora of sympathetic symptoms. As I said, watch out for patients with whiplash, patients that sometimes come in with chronic sinus problems. So for a whole range of problems, don't forget to look for trigger points in the sternocleidomastoid muscle. That's the trigger point of the week this week. Hope you enjoyed it. Please take your time and like us on Facebook and on YouTube. We really appreciate you watching our videos. We've now got quite an interesting library to share with you, and we look forward to seeing your comments, and please feel free to share this with your friends and patients. Hope you enjoyed that today. Thanks very much for watching. Thanks for your time.